You're live.
Okay, so this is Senate Health and Welfare, and we're back looking at page 938, and we're Katie on page what, 1920?
We just finished 19. We're moving on to 20.
Okay,
Okay. In subdivision B1, we have that the office or community partner is providing notice to all applicants regarding penalties for fraud at the time of their application. And 2, that there is no penalty to a household for good faith and material error that was corrected upon notice. Subdivision 3, a household that knowingly fails.
don't have to read it all.
I'm sorry. Yep.
Yeah, you can
Okay.
say above it.
So this is more penalty language for false or misleading information. Pending the outcome of a human services board hearing, there could be a referral for prosecution. And subsection C, household may be terminated for refusing suitable placements. Subsection D, member or members of the household subject to immediate termination for criminal activity or misconduct not related to a disability or victimization related to abuse, sexual assault, or stalking, and a definition of misconduct. 2211 is our prioritization section. Subsection.
Hang on. Let's go back up. This is a whole big fraud section. I know that there have been some concerns about this, so I'm going to look first to AHS about the thinking behind. There's a lot here, obviously. I think criminal intent is important, and I'm wondering what level of fraud or false or misleading incomplete information. Residency, I understand that. Disability status. So go ahead.
Thank you, Madam Chair. Brendan Atwood, Agency of Human Services. So I think we're comfortable with the language in there around fraud and misconduct. The area that we would want to turn the committee's attention to, so maybe in a moment, if you want to focus on that piece first, but here as well, is in the area around the termination for misconduct, in the exemption that's in there for folks who may commit that misconduct, if it should be.
Okay, we're going to get to that.
Yep.
I understand that. That's Brenda, you had a comment?
Yeah, Brenda Siegel and Homelessness Vermont. We think that the fraud section is way too extensive. And just very quick example is that we had a client withdraw from a hearing the other day because they were accused of giving false information. They had not given false information, but it scared them so much that they were accused. And it will interrupt their ability to advocate for themselves and other people's ability to advocate for folks. There is a current fraud process that I think we could refer to, and that would be, we still don't love, but at least that would still put a nod to that you can't commit fraud in the program without having it be so extensive and explicit that that might scare you out of actually doing something like going through a hearing.
Okay, so Brendan, did you want to comment on the current fraud process and how that relates, or Lily? Or...
I will say I'm not prepared to be able to speak to what that current process looks like. I don't know if our team is. I can look into that and certainly follow up with the committee.
We don't have follow-up. We don't have follow-up right now. This is tough. I get it.
I will
The
reflect.
concern, I think the concern is that you heard is the intimidation of people who are accused of fraud, how they're accused of fraud, I guess, is the more to the point. It might be said, looks like you got the wrong address in here, right? Pointing a finger. So I'm wondering, is there a way to identify the current fraud process and then have some rules written around this?
I think we're always amenable, or often amenable, to looking at these things in rulemaking. We could certainly consider that as well. I'll notice the conversation from upstairs. I think that this section was important to certain members, and so I certainly can't speak for.
I think I've heard it's also important to folks around the table upstairs. Not all of them, but a lot of them. So I'm not interested in going through and making a change to this one at this point. And I do understand the concerns that you've expressed. We just want to make sure that people they're already intimidated by the process and where they are in life. So that's concern. So I think we'll just hold it here.
What about just the fair hearing part? Sorry.
Excuse me?
What about just the fair hearing part?
I'm
Okay.
moving on.
Okay.
Gonna move on. Yeah, we're gonna have to move on. And if there is a process currently in place and something can be worked out by the time this bill gets over to the House, there's still that process. They can send us for the proposal amendment. They can conference with us. But I think we're at the stage of keeping going to concerns. Okay. Kate, motion.
Okay. So we were on 2211 prioritization.
Oh, no, we're on number
No,
2 on
we're
the
not.
top of page 21.
Okay.
Conduct that is not related to a disability or to victimization related abuse. That one?
Yes, correct.
What's the problem with that?
So the concern there is that the safety of all participants should be paramount. So these are individuals who may be in a shelter. If they're posing a risk to other individuals in that shelter, there needs to be clear prerogative to remove them from that environment. There have been instances where staff, at shelter staff have been injured. And ultimately they're the ones who are going to be tasked with making these decisions about removing somebody who's potentially a risk. We would add as well that there's, it's unclear to us who would make a determination about whether or not a disability caused a certain risky behavior or unsafe behavior. And again, we're concerned that we're going to end up in Human Services Board.
Yeah, that understood, but I do think that we're going to have case managers with a caseload that's sufficient for them to understand the individuals they're dealing with. So I've thought about this one a lot, and I think we leave it for now. But seriously, I get it. I understand what you're saying, but I think it's important to have some discretion in place for case managers. Others might come back.
Okay. 2211 prioritization. This lists a priority list, items 1 through 6. Subdivision B, this is about proof of an eligible household's disability and the verification for that. That's the list A through B. The presence of a disability shall be verified by the office of community partner. Eligible household is a member of a lifelong disability, such as an intellectual disability, doesn't have to be verified. Thank you. Oh, man. Okay. 3 is compliance with ADA. 2212, page 23, time limits for participation. Levels 1 through 4. And we have language in subsection B about granting extensions to the time limits for reasons in the list 1 through 4, but it's an including, not limited to. Subdivision, section 2213 is case management services. This is where you struck the sentence that a individual or a household can request for a change in case manager. So that is why that straight through is not showing.
This is an important discussion. So I think we need to have some language in there that allows for a request for a different or a change. And we heard that from I think we heard it from Rep Wood yesterday. We also heard from the OEO folks.
Sorry, Lily Sojourner, Office of Economic Opportunity. I'm sorry to catch up. Is it possible to go back for a second to the level 4 hotels and motels
Sure.
to add some clarity on the 12-month period?
So that's lines 13 through 20. on page 23.
Yeah, and specifically, line 16.
Yes,
We have some additional language that we'd like to add, if possible, to clarify what that 12-month look back period is. I think there's been some confusion. Is it a rolling 12 months or from a certain date? And we'd like to ensure it's a rolling 12 months to meet the intention of equity across the program, regardless of when someone experiences in homelessness, as opposed to confusion around a July 1 start date, for instance, which both can
so what would you,
overwhelm the system.
what would you put in here? So, because I'm not understanding exactly until I hear the sentence.
So we'd like to just add a little more clarification. So the 12-month period should be calculated from date of application to the same day of the month, 12 months prior. And then include in that emergency housing assistance received during the time period before shall count toward the 70 days for the 12 months time period. So that it's not,
Can we have that elaborated in the rules? There, because that sounds pretty complicated. What you're
I
saying.
think what we've struggled with is when that has been elaborated in the rules,
Oh.
it then leads to ongoing concern.
Ongoing debate.
Yeah. Our concern without it is
So
that it then
let me
creates-
ask you this question. So each year between April and November, eligible households receive hotel, motel support and support services. They only get that for 70 days in a 12-month period. So April 1 this year, April 1 next year. So they only get those 70 days between April and November, between April 1st, 26th and April 1st, 27th. That's what this reads like.
I think we want to make sure that there's not inequity where if you become homeless right now in May and it's not clear that it's a 12-month rolling as opposed to it being impacted by July 1st, you could potentially have access to a longer period of time versus if you become homeless on July 1st, you have then really you're capped at the 70 days. Whereas if you've become homeless at the beginning, we've seen that inequity play out in how this has been interpreted in the past. And so we're trying to avoid that confusion going forward so that there can be predictability for people and consistency in application of the benefit.
Okay. Go ahead, Nellie.
Nellie Marble, Senior Advisor to the Commissioner. Additionally, we're looking to avoid, once this bill goes into effect, we're looking to avoid a hard reset on 7/1, which would create confusion because everyone in the program would exit en masse and would have to reapply en masse.
Okay, understood. Katie, I can see you're thinking.
Oh, well, the word rolling was added upstairs to capture this idea, so I don't
I
think
thought
the
so.
intent of, I should never speak to their intent, but the conversation upstairs wasn't a July 1 start. With
Right.
that said, to the extent that there's confusion, I think you could leave the language as is and just add a clause that says as calculated by, the first date of the application to the whatever.
That is exactly
Lily,
the
Gina.
sentence we should have.
So,
Do it. That's
I could
good.
put that in.
Yeah.
Okay.
Do it. Do it. We're done. Okay, we need to move right ahead to case management services, because that's gonna be another discussion. We have two more bills too. We're not there yet. Just asking, just relax. We had time on, and we want Nolan to be at the head of the table. Case management services, the question has always been, and when I do, there could be some flexibility in here for people to ask for reassignment.
Okay, so that sentence was removed on one of the previous markups.
Yeah, I know.
I could add it back in as it was. I could add it back in a modified way. If you're looking for a middle ground, you could say something like they may request, but there's not a guarantee of reassignment, something like that.
I think that's a good idea. Have a may request case manager. Yeah. Thumbs up.
Okay, needs assessment, this is the advice to the Department of Housing and Community Development.
Okay,
No. I thought it was in C's. 2215, this is your appeals right to fair hearing. So you have your notice. We've already talked about this today, what's in the notice.
Yeah.
And B, this allows to file a request for a fair hearing. In these circumstances, 1 through 3. And C, this is the 60 days, and you made some changes here. Subsection D, the household files a request within 14 days, they can continue to receive services unless one of these circumstances are met. New language that we're clear that we're referring to fair hearings, as described in Title 3. Then you have your rulemaking section, which addresses a number of items. Excuse me, new items are process for reinstatement of services after termination. Annually, sorry, where am I? Reporting, annual report.
I'll take one comment from Amy, who was not in the room earlier on rulemaking.
Oh, I'm sorry, did you already talk about?
I don't know, what are you going to talk about?
Well, I just wanted to note that, VCAP has requested, I believe HHAB also has requested additional process named around rulemaking and not only a reference to the Administrative Procedures Act, which is a very limited rulemaking process.
Okay, well, we're good, but we're bound by our Administrative Procedures Act.
I missed the comment. You don't like the cross reference to 3090.
So I don't, of course, we want you to follow that, but
Wait till we get to, there's a section here on rulemaking, is that what you're?
that's where you're
Yeah, I
just
know,
past it.
but.
Oh, I thought you were on the fair hearings.
No, I'm on rulemaking.
Okay.
Yeah, we're not.
We weren't there yet.
We're not there yet. We haven't started that yet.
Yeah, here we go. We're good.
We did go through rulemaking.
Yeah. You were moving on
Early.
reporting.
We went through it earlier.
Now you're on reporting. Sorry. So which section?
I'm confused. I have comments on the rulemaking session.
2217.
Yes. Okay. Which we have submitted in writing a few times, 2216. Yes, you are bound by the Administrative Procedures Act, and I have seen in statute before additional requirements for stakeholder involvement, for public hearings to be held. We asked for
It's in the
clarity
bill.
around
It's in
accessibility.
the
It's
bill.
later in the bill.
Oh, it's later.
It's in the
Yeah.
bill. We've been through this, so let's keep going.
I'm sorry, I was out.
You're good, I know.
Okay.
It's okay.
Okay, so then we have reporting. This is an annual report. Those are all the items. Then on page 30, this is the merger of the continuums. Section 6 is grant requirements. This takes effect after the continuums have been merged or attempted to be merged. Section 7 is your transition language. Again, this recognizes that not all elements of the program are going to take effect on July 126 when the section takes effect. So this gives a runway that the various elements of the program will continue to come on board over the fiscal year. This section 8, Amy, I think is what you're looking for. Yep.
My apologies.
So we have the rulemaking. I mean, we spent a lot of time on this. I don't know if you want me to.
No, we don't need to go
Change
through
some
it again.
dates. Public stakeholders.
Hold on a second, we'll allow a question. Or comment.
Okay. Deanna Hartog from All Legal Aid. I just want to note that we have two concerns about that provision that is in blue. The first being, I know this is still it's still disputed, but I just want to say for the record that the reference to the rules that were incorporated by reference is our understanding is that those rules were not promulgated in accordance with the APA, and so therefore there are no rules to incorporate. But even further concerns is that those rules are insufficient for running this program according to the bill. There's nothing in those.
Understood. We're in an interim process. We have to deal with some set of rules. We don't have any rules. So we're gonna deal with the ones that we do have that were in LCAR. Approved by LCAR. So that's all we can do. Then we're moving to emergency rules, which will be different and will be more in tune with the continuum. And then we'll have permanent rules. So this is a transitional process. And we're not gonna be able to pin everything down. Believe me, you know, so I appreciate what you're saying. And I've been on rules a long time.
Just because as is on July 1, those rules will not
Understood.
refer to anything here about community providers.
No.
Okay.
We understand how this goes. We get it. Okay.
I'll keep going.
Yes.
The section 9 is an implementation, a status report coming back to you in February. And then we have the 602 language that was referred to earlier. This is addressing the needs of households for domestic and sexual violence separately from the continuum. Next is the Vermont Rental Assistance Bridge Program. We made some changes here. So you'll see those reflected in the new draft. Payment rate structure for shelter services. Section 13, capped room rates. 14, expenditures. We've already gone through this a bit. I don't know if you want to hear more from Nolan on this.
We will in about 1 minute.
Okay, I will happily give it. And then you have a written report. You are removing the GA annual report. And then you have effective dates, which we haven't been through, but it's worth just spending a minute on. So you have the effective date section, section 8, which is the adoption of permanent and emergency rules taking effect on passage. You have, except for section 6, all remaining sections are taking effect July 1, 26. Sections, that grant requirements piece that doesn't take effect until there's an attempt to merge the continuums. So those are your effective dates. And that's it.
Good, thank you. Chad,
The payment rate, Chad Simmons, HHAB, the payment rate structure section was one of the areas that our members had some concerns about and had suggested language, some slight changes to that section.
can you point to a specific place? We spent
So-
1 minute on it.
Yeah, so I think
A lot
what
of time.
we would prefer to is just to clarify that this would be a report rather than dictating that we will go to a rate structure and that that the community partners and department would work together on developing that report collaboratively.
May establish a payment rate structure.
Or shall submit a report on.
Well, they're getting a report. Nothing can happen with that rate structure until it goes through this building. So it's, and I see April 1st for me. April 1st is a little late.
How about propose instead of establish? I'll
Yes,
propose.
propose. Propose work.
Yeah, and I think we'd also be open to moving that time frame. I think this is a really significant potential change.
Totally.
And given the significant lift of other aspects of the bill, I think we'd prefer this upcoming year to focus on some of those. If this is going to be kept in as a report, we'd even be happy if it was a year later to report. We just feel like it.
I'm not keen on the year later piece, but I am keen on giving more time for it. So I think we could have an interim report on April 1st, 27, and we could have a final report in the fall of 27. What does that do to your life?
So changing it so the objective that you're looking for is a report we do an interim report and then a final report, which would inform the next year.
Because if it's in the fall, then that gives time for a lot of work to be done, including joint fiscal looking at it or others. So we need to know what that is. There's a lot of budget stuff that goes on with it too. Okay, so if we have an interim report, April, and a final report,
October 1,
yeah.
but I'm asking.
I mean, it's a lot, and I feel like we're
I hear you.
also appreciating your
Is it October
flexibility,
1st or
so
November 1st. Which one would you like?
I don't know that it matters.
Take November.
But November's fine. Thank you so much for your.
That's how I give my kids choices. Do you want to go to bed?
I
7 or
appreciate it.
7:05?
It's an effective. I appreciate your entertaining.
I understand what you're saying and I'm empathetic, but we also need to have this get through the legislative process. We need Nolan for 15 minutes. Thank you. Katie.
You're welcome. Did you also, 817 and 293?
And can we wait and do
You
that?
sure
In about-
can. I'm leaving at 11.
I thought you were leaving at 11:30.
No, you
11,
have me
she
booked
said.
to 11. Another committee has.
Okay, so let's do 8. Nolan, are you okay with, you won't hear anything?
For you,
Thank you.
Careful.
Okay, we're gonna look at
You
817
need
and
to go upstairs
293.
too, but.
My suggestion to you folks is to give space for the people who need to get into those channels.
Thanks.
Yeah, I know.
You have way too many people in here, Southern.
I know, I've been very lax with my crouching. He doesn't want to get beaten up.
I'll go.
I don't want to.
I prepared my children.
That's why I'm gonna leave.
Right behind you.
Zoom is one thing, but in person's a whole other thing.
It is.
Yes.
Are you okay?
You can't go against him and miss the person. That's a little yellow can.
All right.
Now we're doing it.
817.
Oh, yeah.
Okay, thanks, Sean.
That's gonna be the report. Hopefully.
New version.
Okay, so here is the new draft 2.1 of 817. First, this looks different than the last time you've seen it. First, you have a new legislative intent section. Says that it is the intent of the General Assembly that the Department of Health, in collaboration with AHS, shall oversee a mental health literacy training grant program to provide mental health literacy training to educators and other school personnel, and a peer-to-peer mental health program to support structured opportunities for student-peer connection in a supervised school or after-school setting to take effect on July 1, 2028. So those descriptions of the two programs were taken from the prior section 1. In section 2, you have language about funding as part of its fiscal year 28 budget presentation, DMH in collaboration with AOE. Was this supposed to be AOE? Yes, it was.
Yeah.
Yeah.
Good catch.
Yes.
DMH in collaboration with AOE shall explore potential funding sources for the mental health literacy and peer-to-peer program described in section 1 of this act, including whether any existing special funds are appropriate sources of funding, and provide recommendations accordingly. Section 3, inventory. On or before January 15, DMH in collaboration with AOE is to submit an inventory of existing mental health programming and services in schools to the policy committees. The inventory shall include a recommendation to integrate the mental health literacy and peer-to-peer programming described in section 1 of this act into the existing programming and services listed in the inventory required pursuant to this section. Effective date is July 1, 2026.
Okay,
At school. There needs to be a parent notification process.
oh, well, we're not doing a program here, we're just getting a report.
Oh, okay.
Yeah, we're just getting a report.
No, I'm good.
Anyone else?
I'm good.
Debatable.
You got it.
All right, I see, Anne, you have your hand up.
Yeah, Amy Schulberger, Vermont After School. I'm just wondering for the training, literacy training, if you would include after school personnel as well, because educators and school personnel would not necessarily include that.
Okay. Can we do that? Yes.
In the legislative intent.
Yeah.
Training to educators. Other school personnel. And after school.
Yeah, school and after school,
Mhm.
or,
Well, the school in there.
I know, but after school is a separate.
That's a program.
Thank you.
Yeah, that makes a lot of
And after
sense.
school staff, is that right?
Sure.
Well. Do you mind?
The peer-to-peer program. I'm getting there, just looking. So. Jill,
Jill Smudgepop, Karen for Mentor Vermont. So Mentor Vermont does peer-to-peer programming in schools.
Okay.
Right now, they don't call it a mental health program, but they do a lot of peer-to-peer. So I think they can really inform a lot of this
process, and
So I don't know if you wanted to.
I'm fine with that.
Yeah.
Yeah, no, I'm fine with that. Can we put, such as, or?
I'm not sure what the feedback is, to be honest.
It's hard because we don't usually mention specific
Yeah.
organizations.
Yeah.
So we could say something about, mentoring programs or.
Where?
So some of the mentoring programs.
Where do you
are
want
part of
this,
the
but-
school.
Is this part of a report or this is part of the
That
legislative
would be part of
intent?
the report of like how they are.
So in
assessed.
collaboration with DMH and stakeholders?
Mhm.
That would make sense.
Okay. Clear.
Nancy Nicole, guys, if you in section 1, it has Department of Health in there, which I think is us.
Oh, mental health.
Yeah, and
Thank you.
I do think we would want, if possible, to have AOE named in this section as well, since we would be collaborating.
We just changed that.
We
So
did.
it's
Oh, okay,
collaboration.
okay.
It should
It's
have
there.
been human services.
She just did it. And you just can't see it. All right. I know, this folks need to know, we're gonna be on the floor for a long time, so.
I can make a motion.
Yep.
Is it still draft 2.1? 3.1. I move to pass favorably out of committee into the full Senate, page 817 draft 3.1.
Can we do that with pending edits, just because I can
Pending edits. Yeah. On, May 8th, 2026.
The draft's the same day, right?
Yeah, it's 5/8.
Right.
As we speak.
Yeah, but it's the date of the vote.
Yeah.
Here, this is favorable with amendment. You ready, Madam Chair? Senator Benson? Yes. Senator Cummings?
Yes.
Senator Hewlin?
Yes.
Is that better?
That's what you, no, you've been getting it perfect. for a long time. Thank you.
Senator Morley, yes.
Yeah.
Senator Lyons.
Yes.
What did Senator do about it?
Huh?
Nothing. Just I voted for that several times.
So. Is there someone who would like to report this? Yeah,
I can
okay.
go to approach the finance.
No, I don't think there's
No.
any money.
Oh.
There's looking for money, but I don't think there's any money in there.
Might go,
The underlying bill did have
I
money.
might go, but it'll be a quick trip. I might wind up doing a fiscal note saying there's no fiscal note.
Today, I'll send you a clean copy, but I'm gonna run it through the editors first.
Katie, we also have 293, which it has just that one last section. That we should look at, but that's the rest of it is what we looked at. Man. I go through it.
Sure, this is 293. You looked at this maybe yesterday, was that yesterday?
Or the day
The
before.
days kind of went together. There were changes, just items that I caught.
yes,
There are two of them. One was just the reader assistance heading. For ALS, disclosure requirements and reporting, because the new reporting section was added and then struck. And I'm trying to remember what the other.
We went through the whole thing and it was, at the end, there was reporting on
Something,
funding for recovery centers.
did we make I struck, that's right, I struck this language.
Right,
Fiscal years 24 and 26, since it was up above. It had been in 3. So now that is removed. So those are the two changes since the last time we've seen this. So this is version 3.1. Do you want a refresher of what's in here?
I can't read them.
sure. It's,
You don't.
I don't need it.
we don't need it. We went through it yesterday. And the Department of Health is interested in having it go forward, so. It's their bill. I can't accept the motion.
I need a. Let's see official motion.
I'll make the motion to pass favorably to the full Senate draft 3.1 of H 293.
2.1. Oh, did I just say 3.1?
It says 3.1 on
Then
there.
use that, I'm sorry.
H 293 on, the 8th of May, 2026.
Discussion, I know it's not a heavy lift on this bill. It's really a limited reports, modifying some reporting. And adding in some reporting to, one of the things I think we have to do overall is to start looking at all the work we're doing on prevention and recovery and understand what all is out there. And this has a little piece in it for that.
Senator Benson. Yes. Senator Cummings.
Yes.
Senator Gillen.
Yes.
Senator Morley, yes. Senator Lyons.
Yes.
I'm not recording this one.
No, you're not. Senator.
She's got a little-
Oh, yeah, she's on this. She, yeah.
I
I've
don't
already-
understand it. I used to be the only one that understands all these.
Let's just report. Just report. All right. Senator Benson, would you like to report?
Oh, I've already written it.
Oh, okay, good. All
If
right.
you want, Benson, I don't care. I can scribble.
No, I don't, I'm
I get some pretty
agnostic.
gruesome reports, so.
Yeah, calm down, Benson.
You need to redeem yourself.
Don't wait. Yeah. Give them a really,
Okay,
Give Benson.
okay.
people had to leave the room to shake that off.
So I'm great.
I came back with the frozen chicken, so.
You did, that was good.
All right, thank you all. I know that one, that was just kind of like the Department of Health brought the bill in the first place and made the modifications.
You got taken off.
You're gonna. Okay. So now we're gonna go back to,
So you said Mason.
money.
Would you like something?
She worked.
Like that?
It's helpful.
Okay.
Thank you very much.
Yeah.
Take care of that.
Michael Strays, Barry firefighters. 4 dead kids Christmas Eve. And the fire alarm didn't go off. So their work was, they wanted to know why that alarm didn't go off. These kids all died of smoking. You now have to have a photovoltaic.
Yeah.
Smoke detector because
Switch
it is like 2 seconds more, it's more sensitive to smoke and heat. But it's the smoke that knocks you out, so you don't wake up when the alarm goes on. And that was theirs. Yeah, you had to go home with your Christmas morning with your kids.
Feeling of this. Thank you, Katie.
Thanks, Katie.
Okay, Nolan,
Bring it.
we have on yesterday's, days, we have your spreadsheet.
You want
have
the
a
new one? Yeah.
Yeah, with
This is a
like,
new spreadsheet. Yeah, I don't have a hard copy.
Ooh, a new spreadsheet.
I
New
know.
colors.
Same colors, but there's one new color.
If
you move over again, same color,
One with the green.
different colors, same green taste. All right. Only difference on this sheet.
That's
And if you have your old sheet, you can write it in, or I haven't sent Felicity yet. I will send it to her. Actually, let me send it to her right now. I have it all. 500. I have it queued up. I just gotta hit the send. All right. I just sent it to her.
Thank you.
So I didn't print a copy out because I didn't expect to copy it today.
Okay.
But basically the only changes are they're all highlighted and they're all highlighted in black, like deeper black. So you can see, so in the 938, the center line proposal, it should say, and I'll come over proposal. You can see that the 9751120 is now 9.25. Right, so if you go across, you can see the delta is now 500,000. So we took $500,000 out of the emergency housing. And we created a new category on the bottom, Community Resource Center, CBOEO. And add that 500 in the base GF, so you can see on the other side, it's up 500. So the bottom far right is still all zeros. All we did was take 500,000 from the base one time in emergency housing hotels and added the Community Resource Center. Senator Moreland, is there a joke that I'm not?
No.
I know what he's left.
I'm not using enough color.
No, something to do with the location.
An excellent.
So this has been an orphan for many years. We'll be interested. Calista just posting this right now, so we don't, it's hard for me to look at it.
Where I can't see it? You blow it up? Or
I don't know, can you blow it up a
I
little?
can blow it up some. I
I can
apologize.
pull out the other one.
I'm sorry that I don't have hard copy. Here.
Somebody got it.
Oh, hello. Don't know what happened.
All you've done is you've added a square all the way across.
I don't know what.
Off by side where you added it.
Right, what the 500,000 we did, I thought we were taking out a motel.
Yeah, that's what I'm.
But it is out. That's what-
Emergency housing, hotel, yeah.
Okay, I know, and that's a problem for some people, and it'll, but we need the money from somewhere. We could nickel and dime, we could take a little bit out of each of the different rows. and do
It's weird.
that.
I'm all my doors.
But I'm sure the house will have something to say.
That's as much as I can blow it up.
This was a recommendation. that we need to make.
So that's the only change in the appropriation that you've made in this version. As you can see, the bottom lines are still the same.
So that'll reflect in language in the bill.
It is reflected in the language in the.
Okay, committee. Given the time that we've had to spend on looking at the need within each level. And after hearing from Rep. Wood on the work that they've done with the funding piece, I'm happy with leaving their funding more or less intact, with the exception of the hotel motel. And then, I think they'll be okay with it. Let's see how that goes.
And to that point, you heard Lily talk about how that's 17 less
Yes.
rooms and we took it off to 700.
Right.
Okay.
Okay. Brenda.
I'm just wondering if that could come from a different place, because 17 rooms is potentially 68 people, if it's a family with children. And so that's a lot of rooms, beds that people lose, potentially, and have to sleep outside of each night. So the number total is a lot.
So the question is, and that
I agree with you.
that's something, believe me, it's something that I've been thinking about as well. So I'm gonna ask the committee just to look briefly at, we have a few minutes here. Why don't we go down the list of what's available within, as passed by the House? We've obviously taken it out of hotel motel.
Part of what the resource center does is helping those rooms, right?
Yeah,
So we're giving
No.
them,
they do everything.
some of us are more familiar with them than others.
But they don't have beds.
Yeah, no, they don't have
They don't have
that.
beds.
They're where you get into the system and they can refer you. But if you take this out and there are 68 less beds for them,
It won't be referring so much.
they won't be referring as much. I understand Chittenden County has the bulk of them.
Madam Chair, another suggestion. And DCF may hate this. You could not take it all out of one place.
That was my suggestion.
Spread it out. So maybe you take 250 out of emergency housing, you take some out of HOP grants, you take a little bit out of rental. I'm just throwing that
But then
idea.
you have only one group, right? You gotta make a whole bunch of them.
I'm just saying if you don't, if you wanna.
Spread the base.
Emergency housing's already being cut, isn't it, from current, so. It's scary to think of cutting more.
Let me see what
Right,
the
I
governor.
appreciate what you're trying to do.
The community resource center is a daytime resource center, so there's a place for people to go. And so it's under CDOEO, which has, also has a nighttime 100-bed triage center. There's a daytime center, a nighttime center. And then they have other services that support services. So this is what we have on our webpage from Paul Dragon, yesterday.
The other thing I
And then
can-
also testimony. So it's not, we're not saying that the resource center is simply a place to direct traffic. It does more than that.
Also, if you look at the old sheet, you can see in the gov rec, the House version is 1.3 million more in base GF than the gov rec, and 2.3 million more.
Wait,
Total,
sorry,
right.
can you say that again?
So the governor had even less money for emergency housing. He had 21.5, he had 8.4 base, and the House put it up to 9.7. So even with this reduction here, you're still above what the gov recommendation was. So that's another for context.
Could we get rid of the other expenses and move that into it?
The other expenses, and I'm going to defer to BCF, it has a purpose, and most of those
Yeah, but
are.
it was different than the House version, as I recall. You ended up having the governor's recommend, which was doing one thing, and then you had the House version, which was doing something else.
Also, in the other expense,
Was I recall, I'm just, number eight.
So
May I-
it's also federal funds on this version. You can't,
Yeah,
you can't.
yeah, that's the problem.
Yeah, you have a lot less flexibilities to move those federal funds. And when the House moved it over, they did their due diligence to make sure that those federal funds could be used for it. Right?
Yeah, under Lily Sojourn, Director of Office of Economic Opportunity, under the House proposed of other, that is federal funds that.
Yeah, but not underneath the administration. Administrations was all base general fund.
Right, so I guess that's a question of which are you looking at, because then in the House version, they moved that general fund to other things.
Either way, you're
No.
gonna have general fund impact. Because you can't, if you take that away, you either want to give the other expenses for more general fund. And then you're losing the federal funds unless you find another perfect federal funds.
Okay, so you
Sounds like I wouldn't, well,
you're either gonna stick with what you got there, or you're gonna hit everybody. Or you're gonna deal with it.
So
You're gonna deal with it. So.
Yeah, right.
or for the proposal amendment.
Yeah.
So if we look at, yes. Emergency, if we look at hotels and motels, governors recommend was,
in the base GF was 8.4.
in the base was 8 million.
This is still 1.3, so you take that 500 out, it's still
Over.
not
What?
800,000 more.
Yeah.
Correct, but again, this is your decision about priorities.
Right. Beverly wanted to.
Go ahead.
Hi, Beverly Boget from the Vermont Early Childhood Advocacy Alliance. I want to say two quick things. That one, I really support, you're looking for funding for the CBOE of day shelter. And two, at the same time, I want to recognize, as you make the consideration of where the cut comes from, just to recognize that, to support what Brenda was sort of saying, that the general assistance, emergency housing money, the comparison isn't necessarily the GovRec to this number, but from what last year's funding was to this level. And last year's funding was something in the neighborhood of $38.5 to $39 million,
Right.
depending on what's included in that number, just for GA and emergency housing. So that's the comparison of the cut, the magnitude of the cut as you make your consideration.
Conditional cut. Yeah, got it. Okay. So let's go right down the list then.
So assuming you want to do this.
Shelter development's already been decreased by the
You've
House.
got HOP grants,
Mhm.
you've got shelter development. Got emergency housing. You have eligibility staffing. You have case management. Permanent and supportive housing. Rental assistance. Or you take it at a one time. But then you're only making a one-time appropriation to CBO, yeah.
No, we need to keep it in base.
Okay.
What are the consequences of taking? The House has reduced HOP already. But
I reduced HOP by 1.8 base GF and 2.2 total.
so
I
if
guess I would ask Lily, what's the impact of taking some money out of HOP? What would that do?
we could take, let me just say this, we could take 250 out of HOP and 250 out of hotel motels, just to look at a
Well,
different,
you've
or
already-
we could take 500,000 out of HOP.
But you've already reduced it 1.8.
Yeah.
You've already reduced it 1.8.
What, the hot grants?
Yeah, that's already happened, but I'm asking Lily.
Okay.
Sure. So I think, again, in our governor's recommended budget, it, accounted for maintaining a level of service that currently exists, as well as investment to shelters that we know are coming online next year and that we've already invested startup funds. So that includes shelters with, Upper Valley, Haven Groundworks, Brock Community Action in Rutland, just to name a few, as well as investments in some of the specialized shelters called out in this bill, right? So that includes where we had money for the additional shelter for those who are medically vulnerable, as well as recovery oriented shelters. So, if it was to be reduced, we would either not be able to invest in those new types of shelters that the bill identifies, or we're taking away from providers that are kind of currently providing services, or again, shelters that we're expecting to become online. I think Northeast Kingdom Community Action, they're another one. They have a expansion coming online in the middle of this year. So that's sort of in our governor's recommended what we had planned for in that line item.
Understood. Okay.
I hear there are no good solutions.
There is no. Well, that's why we print money downstairs.
No, no one would ever take me up in the offer to buy a print item.
So, I'm thinking that with the $500,000 out of the hotel motel is still higher than governor's recommend. And some people like that and some people don't. Huh?
But the governor's always been stingy.
I know. I know. But the goal of the work we're doing is to reduce dependence on.
I hear you,
Well,
and I've said it multiple times. Burlington had to pay $8 million last year. So it's gonna come out of a municipal budget. You know,
But it's coming out of everyone's municipal.
no, I get that, but some to a higher extent than others.
and we,
On a per capita basis, I don't know.
we don't wanna, I mean, the House has added in municipal grants of $500,000. Not really interested in reducing that. And there's no good way to do this.
No.
Chad.
Hi, Chad Solutions, HHAB. I think the top line for us is there's more money needed to be able to provide the services, and understanding that we're going to stick within the governor's recommend. We would prefer those dollars go back into communities. So if the committee would be open to looking at it, and we support the CRC efforts, we think that's a really important resource to continue funding. But I think if we have to look at something, we're looking at the eligibility staffing.
The which?
The eligibility staffing. We would prefer dollars go into communities and provide resources for the people in need and the providers who are needing those. Just one of the reasons why our membership has questions around the strict eligibility sessions.
So I'm confused. What are you asking for, Chad?
The eligibility
Looking
staffing
at
line
that.
item.
Eligibility staffing on the 1, 2, 3, 4th line down and taking,
Take the money out of.
So they already cut it by half.
it's already been cut in half.
And it was already cut by half, but I'm not making the case, like with the idea of putting it into the community, which Chad said, that's why they did community grants. I would say if you cut it further, I think you would definitely need to hear from DCF about what that means.
Yeah, I agree with that. I think that's a problem.
Also a problem of it. Take people out of the hotels.
Well, we're not necessarily kicking them out. It's just that we don't have those spaces available
Correct.
for the coming year. I mean, it's not like we're holding hotel rooms right now.
So how many positions is the eligibility staffing? What are we contemplating? Does anyone know? And are they spread out all over the state?
I'm gonna defer to DCF on that.
Brandon, do you have an answer?
I'm sorry, I was distracted. Please.
Or no?
It
Or
includes,
Lily?
I'm gonna try to see if I can find notes. It includes, part of that work is contracted out, so it includes, support for that contract, which is the function of, right, if people call, there's someone to talk to and go through the process. And no, it's, yeah, thank you. I was gonna say RCA. I think that's the old.
That's a commercial.
RCA. So, again, it's the function of, if you don't have someone there to determine eligible, like people then can't access the resource, right? So I think it's adequately staffing that system to avoid things that we've heard from constituents is really problematic, like lengthy wait times. The ability to, again, talk to folks as these new roles and systems are coming online. I mean, I think this is where, whether this stays with the state or stays with the community, you can't undermine the importance of having folks there to walk people through the system, determine if they're eligible, so that they can access whatever the services that we're trying to provide. And again, that's already been cut significantly. So
1.1 million.
I mean, again, these are hard discussions and we have them internally as well when we then have to come up with our governance rec. And at this point, we can just speak to our motivation there and just help explain any of the other line items that's helpful.
So I do want to point something out, that the money that's been taken out of eligibility by the House is actually added in. There's one time. No, it's the same. They're all the same. There's more one-time money than there is base. If we take base funding out of that, that could be problematic. We can't put one-time money into base. So that's our problem. We can't reduce one-time money and then say it's base funding.
Right.
So that's why when you look at this, that's why I look at the hotel motel and say, that's where the money is, when you go to rob a bank. And so, right.
That's I haven't heard that one yet. This is good.
I mean, trying to be optimistic, how many, we're developing these shelters, so is there a chance that some of the folks who would have been in the hotels will now be in shelters? And if so, like how many?
Also, is 500,000 the right number?
I think it should be higher. Honestly, I think it's about 650,000.
That's why I went to the.
I said 500 is a low number.
So why didn't it make it in the House?
Because the House didn't have the same concern. We don't have to do everything the House does.
It's true. We're the same.
Amy, did you want to comment or?
I'm waiting for Paul to text me back. Amy Schallenberger, for VCAP. So I think it's worth saying first, there's not enough money in the bonds. That's the problem. And whatever you fund, you're going to be taking money away from something else. So that, I think that's a policy decision that the committee needs to make. We really appreciate that, that the committee is considering base funding for the CRC. I do want to just remind you that the big bill has one-time money allocated.
Half 250.
The Senate had 234,500. So although that's not ideal, I think the House had a higher one-time amount of 469. I think you could consider splitting 250 from DMH as one-time funding, and then you would only need to.
Are you talking about the big bill now?
Yeah, the big.
Okay, that's not a conversation in this room.
Okay, I was just trying to
totally not a
have
conversation in this
Yeah,
room. What we're talking about is how to fund the CRC based on the money that we have. We're robbing Peter to pay Paul. We all know that. And we know that there's, I believe that we can do it with hotel motel, also understanding that come next year, there's going to be a BAA. and shelters are going to be built. I don't want to do any of that.
You have 5 minutes.
No, we don't. We have 2
You have
minutes.
2 minutes.
I'm fine with what you have presented there. Don't know what it
It's going to come.
Yeah,
Yeah,
I say send it to the house and we'll duke it out.
Yep.
Okay,
And to,
and the budget will become a part of it. At that point.
One local motels, people start sleeping in my yard. You see.
All right, so we're good on Tuesday, committee, procedurally, we're gonna go off live and just talk about our process a little bit.
so we're not voting on this today.
No.
No, no, what we're